So now let's get back to Jenna Tosh. Jenna, you're also the CEO of Planned Parenthood of Greater Orlando.
That's right.
Ann Romney had mentioned that Planned Parenthood could still exist, still do the work that it does, even if the federal government were to defund Planned Parenthood. Is that an accurate statement here in Central Florida?
No, I think you really need to look no further than Texas if you want to really understand what Governor Romney's plan is for women who rely on Planned Parenthood. Starting about 18 months ago in Congress, there was this big shift to start shutting women out of cancer screening, cervical cancer, breast cancer screenings, and to shut down the nation's family planning program. And that's exactly what's happened in a number of states across the United States. In Texas, thousands of women have been cut off from what's, in many cases, their only doctor visit the whole year because legislators wanted to cut women out from Planned Parenthood. And so when you look at what's happened, no, there haven't been all these other providers that have sprung up willing and ready with the capacity to care for these women. You know, Mitt Romney has said in no uncertain terms that he wants to get rid of Planned Parenthood. And for the nearly 3 million women across this country who rely on Planned Parenthood, I think that says an awful lot about what a Romney presidency would mean for women.
All right, Jenna, hold on. I have to move your hair here on your microphone.
Okay.
We ladies, we have all these things to worry about as we do these interviews.
No, I think it was out of the
All right. So Planned Parenthood serves 81,000 women here in the Central Florida area.
In Florida as a whole.
In Florida as a whole.
Yeah.
How many of those women come to Planned Parenthood for preventative services?
94% come for preventative health services. So we're talking about 18,000 women who get a breast cancer screening from Planned Parenthood every year. You know, the vast majority of what Planned Parenthood does is non-judgmental care, sexually transmitted infection prevention, birth control, breast and cervical cancer screening, health counseling. Planned Parenthood exists to turn misinformation into facts and to empower women to take care of their health and to be healthy.
Now, give me an idea of what the average woman who comes into Planned Parenthood in Orlando is needing. Do they?
Sure.
What is their income? How old are they? What are they usually coming there for? And what kind of services would that average woman here in Orlando get?
Well, I'll tell you that the average client in Orlando is between the ages of 20 and 29. She's generally uninsured or underinsured. Most of our clients, actually, many of our clients are moms. And so women come to Planned Parenthood because they know that when they come to Planned Parenthood, they can have their annual well woman exam, which consists of a cervical cancer, a breast cancer screening, blood pressure, and they come because they need access to affordable birth control. I mean, you know, when you think about what birth control is to the average woman who's a mom, birth control costs for the year what the average family of 4 pays for groceries in 5 weeks. And so if you're a mom that's really struggling to make ends meet and you have the choice between paying for your birth control prescription or putting food on the table, there is no choice at all. But that, of course, puts women at risk of having an unintended pregnancy.
Are there other places that provide birth control and preventative screenings to women for, what is it, a sliding scale? Is that how it works?
It's very low cost.
Okay.
Yeah.
Are there other places that do that if Planned Parenthood goes away?
You know, there's the health department, and there are some providers that are currently struggling to provide those services right now. There's no question that, you know, Planned Parenthood is the leading healthcare provider for women in this country. We're the leading advocate for women and women's health issues. Nearly 3 million women rely on Planned Parenthood every year, and like the example of Texas that I mentioned before, cutting out Planned Parenthood from that provider in Texas required the closing of several clinics, and there haven't been other providers that have stepped up to see those women, and that effectively shuts those patients out of healthcare. It shuts those women out of that one doctor visit that they have every year.
Okay, when we come back, we will talk about abortion and the controversy that surrounds Planned Parenthood, and we'll also ask Jenna about what it's like to be the CEO of Planned Parenthood at the age of 29, and some of the things she's had to deal with her own family and protesters. We'll be right back here on Flashpoint. Stay with us.